Welcome to Age Well with Joy. I am Joy Pate, the CEO for AgeSmart Community Resources, your area agency on aging. And today we're here to help you with your caregiving journey. Caring for an older adult and a family member can be a daunting task, and many times we see caregivers exhaust themselves. We just all want you to know today that you do not have to go it alone. We're here for you. So today we have Chris Fulton, who is our home and community-based service manager, and Gail Shaw from St. John's Community Care. So I'm going to let you guys share a little bit about yourselves when you're talking, but please go ahead. But first of all, Chris, we hear a lot of times from caregivers and just older adults, boy, I wish I had known about AgeSmart Community Resources when. Can you tell people how to access the services that we provide?
Absolutely. First of all, you can call us at 618-222-2561 and ask to speak to one of our specialists here. The other way is our website, which is agesmart.org. Easiest way, there's a caregiver page for that. And anytime you contact, you can request to speak to the caregiver resource specialist, who will be more than happy to help walk you through this journey.
Great. And there's no charge, right?
No, we are donation based.
So there's no reason not to call and to ask for assistance. So St. John's, Gail, has a bunch of really great programs for caregivers that help them reduce stress and stay connected. Can you share a little bit about those programs, Gail?
Yes, well, I'm Gail Shaw, the coordinator of training and support at St. John's Community Care. Our telephone number is 618-344-5008. And we do have several programs to help the family caregiver. The Savvy Caregiver is a program for those who are providing care to a loved one who has dementia or Alzheimer's. And this class meets for 2 hours once a week. So it meets for 6 weeks. The caregiver walks away with an understanding of dementia and the impact that the disease has on them and their loved one. They learn ways to communicate more effectively with their person who's living with a memory loss. They learn skills to manage their daily lives. They learn resources to help them in their caregiving journey. And they are also reminded to take care of themselves because that is so important. The other programs that we have are support groups, which meet every month. They are a great way to socialize with other caregivers who are on the caregiving journey. The participants gain useful information from other attendees that can be used now or in the future. This is also an environment where they can express their fears and concerns and their challenges, and the others will understand what they're going through. The support groups are a good way to find out that you're not on this journey by yourself. And here at St. John's Community Care, we offer 2 support groups, one geared towards those who are a family caregiver to someone living with Alzheimer's. The other support group is for those who are family caregivers to someone who has either a dementia or some type of disability.
So Gail, there are 2 really amazing programs that St. John's offers that can help caregivers with their stress. Can you share a little bit about those?
Yes, I would love to. We have a program called Stress Busting, and it is another program that is for the family caregiver who's taking care of a loved one who has a memory loss, dementia, or Alzheimer's. This is a class that meets for 90 minutes once a week for 9 weeks. And it is a course where the family caregiver is going to walk away with understanding the stress that they're under from caregiving and how that is affecting them and maybe affecting their loved one. They're going to receive education and support, not just from those who are facilitating the group, but also from the other caregivers who are attending. And they will also walk away with stress management techniques to help them. And that could be things like deep breathing, aromatherapy, music, just things to help them to look at how to decrease the stressful days. Another program that we have is the Memory Cafes, and that is a social event for both the caregiver and their loved one. And this is just a time, it lasts about 60 minutes, and we're meeting once a week right now. And I pick out a topic and we just reminisce. Sometimes we've reminisced about donuts, sometimes, as right now, the season and different things that are going on with the holidays. So it's just a fun time to get together with other people and to talk about things in the past.
You know, it's interesting as our caregiver specialist is noticing in her conversations with caregivers that they don't recognize how much time they are spending on the task. It's just part of life, but they are really, really focused on that. And, you know, taking that time to just breathe, do those simple things to that self-care is so important. And the other thing about the memory cafes is the people that are living with a loved one with dementia often are very isolated, and they tend to become very lonely. And we all know that isolation is very dangerous. So glad you could share some information about those programs. There's one of my favorite services to help the caregiver and the care recipient is adult daycare. Adult day services, I should say. And St. John's has 2 adult day programs. Can you share a little bit about that?
Yes, our adult day programs. This is a safe and stimulating environment for the person who is living with a dementia. It offers peace of mind for the family caregiver who has to work or is not able to provide care all the time. It offers a variety of activities designed to help a person who is living with a dementia or memory loss or who is physically challenged. They provide meals, they provide companionship, and they also have individuals there who are trained on dementia and who are able to assist with the daily living needs like toileting, walking, transferring, and eating. And our adult daycare is open Monday through Friday from 7 to 6 a.m. And we have 2 sites, one here in Collinsville and one in the Edwardsville area.
So Gail, how do people get there if they don't drive and the caregiver, say, has to go to work? How does that work?
You can work with the program director, and she will help you navigate the bus system that comes and can pick up your loved one and bring them to our facility and then take them back home at the end of their stay.
That's great. So they're not riding public transit like the big buses, right?
That is correct. They are using the Collinsville shuttle or the Madison County Transit.
Great, thank you. Well, Adult Day is an amazing service, and there's nurses on staff who can assist with medication and all those types of things. So wonderful,
Yes.
Wonderful program. So there's some other financial resources for caregivers to help pay for that. Chris, can you share a little bit about that and some of the other ways that people can get some services?
There are some people for adult day services may qualify for the community care program and that will help pay for those adult day services at St. John's. For that, we also have AgeSmart has a respite program, which is a consumer directed program that allows the caregiver to select the person who comes into the home to provide respite care for that caregiver. It can also go to pay for adult day services. So if somebody has a loved one going to St. John's or another adult day service, they can use the respite money. It is a reimbursed amount up to $100 a month to the caregiver for paying for respite services so they can go conduct their own business, go to their own doctor's appointments, get a break, take a walk, take a nap, whatever they need to do to recharge, regroup, so that they can continue giving their loved one the care they need on that.
Well, I know many times in our office, and I'm sure, Gail, you see the same thing. One of the things that trips up caregivers is the fact that they don't have their legal documents in order. Can you talk, this is my soapbox, you know that, Chris. It's like, can you talk a little bit about that?
Yeah, absolutely. Legal documents, powers of attorney for both healthcare and financial, estate planning documents, what's going to happen when that person passes away. Not only have those documents drafted, but you need to tell your POA who they are. You know, just because you've appointed someone your POA and you didn't bother to tell them, when the time comes, that could cause a problem for that. Do not keep all your legal documents in a safe deposit box in the bank. Unfortunately, the most times that you need to get to those documents are at 11:30, 1 o'clock in the morning between Saturday and Sunday over the weekend. But always, if you want to keep the originals there, that's fine. Have a copy somewhere safe that you know where it is. Hopefully your POA knows where it is. Don't keep that a secret from your POA, both healthcare and financial on that. Other documents may seem kind of weird. General documents for your loved one. Their insurance cards, their Medicare cards, their insurance cards, a recent medication list. You can have those. The easiest way to carry those is go out and get an inexpensive photo album. Make the photocopies. Slide them in those pages. That way, if you get the call that somebody's been in the hospital or you know you're going to a doctor's appointment, you can just grab that little quick photo album, throw it in a bag, stick it in your back pocket, and you've got all the documentation you need. Keeping a copy of the POA in that book is also a great idea. Knowing this, I will tell you, it is our soapbox. Have your documentation. I just went through the experience. I did not have a copy of the POA with me. I do now. It's in the book. So just having those documentation, at least knowing where those documents are and where you can get to them.
Right. And, you know, I know some people feel like they have to spend a tremendous amount of money on an attorney to do that. And that is a good idea to consult with an attorney. But AgeSmart funds Land of Lincoln Legal Services, and they do a fabulous job assisting with simple documents like the POA. So I just encourage everybody over 18 to have a POA over healthcare and when appropriate property. So there's a lot of other resources, different types of caregivers. Can you tell us about grandparents who are caring for their grandchildren?
Absolutely. It's called the Grandparents Raising Grandchildren program. It is actually the Relative Caregivers program. It is for any relative. It doesn't have to be a grandparent. It can be an aunt, an uncle, an older cousin, but it is somebody age 55 and older who is caring for a relative child under the age of 18. There's three aspects of it. There's a case management aspect, which can help people navigate the school systems, The Medicaid system, making sure that that child has health care coverage. There's also the child, sometimes the child is eligible for temporary assistance to needy families, also called TANF, on their own record, not based on anybody else's, but strictly on their own on that. So that's the case management. There's also a gap portion to this program, because unfortunately a lot of the children end up with their relative caregivers, sometimes just with the clothes on their back, and these relative caregivers don't have car seats, cribs, beds, formula, diapers, whatever, for these children. So the gap can help with that. It can also help with grandparents who are established as taking care of their grandchildren, but as we all know, kids grow every year, so they need new school clothes, they need new shoes, they need new winter coats. So the GAP program can also help with that when necessary. And the third aspect is respite, because the respite, or the grandparents raising grandchildren program, goes down to age 55. We've got a lot of grandparents who are still working, and now they're having to deal with things like spring break, winter breaks, summer break. For that, but they still have to go to work. So the respite program comes in and helps take care of childcare needs in this aspect. It can pay for summer camps. It can pay for, Y day camps that occur during the breaks, anything like that. It can also cover babysitter costs if the relative caregiver needs to go take care of their own medical issues and doesn't want to drag 3 toddlers along with them. It's easier to go, that it can help pay for childcare, so that the older adult relative can go take care of their issues with that. And that program is run by Children's Home and Aid for us. They are our partner agency for that, and they take care of everything: the case management, the respite, and the GAP for that.
They have the childcare experience, and we have the aging background, but we just wanted to let you all know, ask for help. Don't try to think you can do it or have to do it on yourself. Never make promises that you may not be able to keep. And we all know it's like, not everybody wants, I don't know if there's anybody who really wants to live in a nursing home, but never make that promise that I will not let you go to a nursing home, because it could be the detriment of the caregiver. So there are so many things. Any other thoughts or tidbits, Gail or Chris, that you would like to share? Well, great. Thank you. What?
I think we've covered it.
Thanks so much. And thanks for joining us today, and keep looking for additional videos to help you age well your way. Thank you.